What is hereditary spherocytosis? It is one of the few diseases where MCHC, that is mean corpuscular hemoglobin concentration, is increased. Mean corpuscular hemoglobin concentration, the hemoglobin's concentration, that means percentage wise how much RBC, suppose this is RBC, how much percentage of that RBC, how much percentage the hemoglobin is accumulated is the MCHC percentage. Okay, hemoglobin, mean corpuscular hemoglobin concentration. So that is increased, but HB that is HB concentration has increased. So this is one of the few diseases where HB concentration, that is MCHC, has increased. Because percentage is what? Suppose if you are telling 100%, what does that mean? What does that mean? Means if you have taken 100, if the paper is for 100 marks, you have got 100 marks. If the paper is for 20 marks, you have got 20 marks. Both the cases there is 100% only. So percentage is based on relatability. How much one is related to the other? How much part of this is this part? So that is hemoglobin concentration. So since RBC is same, when it goes into the spleen and a part of it has been removed, so it comes as a spear shaped. It loses its central parallel and becomes a spear, spherical shape. So that means RBC has become smaller, no, but it has become round, spear shaped. As the RBCs become smaller, the HB concentration compared to this volume, the HB concentration remained the same or increased, because HB is not removed, just the membranes are removed. So that's why HB concentration will increase in the hereditary spherocytosis. That is what this mean. Normally there is a cytoskeleton which tethers to the membrane proteins such as spectrin, enquiring and band 3.1. There are these sub proteins, sub proteins, I call it as a sub proteins. There is a cytoskeleton for this RBC. There is a cytoskeleton. Cytoskeleton means what? Cytoskeleton means, suppose a human is there, right? This human has a skeleton, right? There is a skull, there is a vertebra, and there is a lower limb bones, upper limb bones. On that structure the human is standing. So these skeleton, suppose this whole thing is RBC, there is cytoskeleton for it. There is a skeleton for it that is consisted by sub proteins, that is spectrin, enquiring and band 3.1. So that's what these mean. When these are defective, when sub are defective, the spleen removes the blebs formed on the RBC membrane, leading to the decreasing RBC membrane, that is spherocytes formation. Loss of central pallor occurs. Suppose this is RBC having the central pallor, this is central pallor, and this is normal RBC. Now it enters the spleen. When it enters the spleen, what it does is, because of this membrane defect, it will start removing the part of membranes, part of RBC membrane. When it removes part of RBC membrane, this RBC will become spear shaped. So central pallor won't be there. So this is called as a hereditary spherocytosis, because spherocytes have increased in the number. So in this case what will happen? MC will of course decrease, because RBC has become smaller in volume. So that's why MCV is decreased. MCHC is increased because the concentration of hemoglobin is same but the volume has decreased. Volume is decreased, concentration is same. Related to the volume, the concentration of HB seems to be increased. So that's why MCHC is increased, MCV is decreased, RDW is increased, because there are normal RBCs also in the circulation. Suppose this is the circulation, there are normal RBCs, there are small RBCs, there are spherocytes, there are small RBCs, there are big RBCs, like this. So much variation in the size is there. So that's why RDW is increased. So all and together what happens is RDW is increased, MCHC is increased, but volume is decreased, because these normal RBCs will form the new spherocytes losing less membrane. RDW is increased, old spherocytes are there that have lost more membrane, that have become smaller, and these new spherocytes which have lost a small portion of the membrane, that are new spherocytes. Because of this difference in size, there is RDW increase. These spherocytes are consumed by the spleen, leading to the anemia. Because of anemia, the clinical features will be fatigue and pallor is present. HB usually 6 to 10 gram per deciliter. Since the spleen consumes these RBCs, so give off the spherocytes. This spleen is working a lot, so that's why this normal spleen will become bigger, splenomegaly, and there is a splenomegaly, and unconjugated bilirubin will increase gradually. Liver can because of unconjugated bilirubin, there is icterus. Gradually liver conjugates over time. Okay, these unconjugated bilirubin takes time, and liver starts conjugating them, and because of this it sends these conjugated bilirubin to the gallbladder. Gallbladder will receive these conjugated bilirubin. Over the time, this liver conjugates and sends this bilirubin to the gallbladder. Then the retention of this bilirubin will increase the gallstone risk. That will lead to the cholecystectomy. Cholecystitis, that's why the surgeons have to remove. The treatment is cholecystectomy. Gallstone treatment is cholecystectomy. Since there is increase in the spleen size, the treatment is splenectomy. In case where there is a spleen present, it removes any abnormalities with RBC like DNA or anything, but after splenectomy there is nothing remaining to remove extra DNA material of the RBCs. That's why these extra DNA materials that are there in the RBCs, which are not removed by the spleen, will appear as a howell jolly bodies. How do you diagnose spherocytosis? There is a standard test called as a osmotic fragility test. We call it as a OFT. Normally RBC has some extra membrane to expand. This RBC has some extra membrane to expand. There is pallor, right? So this is the extra membrane that is there to expand. When this RBC you put in a beaker, this extra membrane is there, right? When you put a hypotonic solution, hypotonic means there is a less salt, like water. So when you put water into it, hypotonic solution, this water, because there is a less concentration here and there is a more concentration here, because of that, from lower concentration to the higher concentration, water moves inside the RBC. Since the RBCs have this extra membrane, they will start expanding and they can swell up. This is in the normal case. But when these spherocytes are there in the beaker, when you put the hypotonic solution, the water will move into it. Since there is no space to expand, this RBC membrane will struggle. That's why these will rupture out. So normal RBCs have resistance to the osmotic fragility test. But hereditary spherocytosis, the spherocytes will burst off because of the hypotonic solution. So this is the diagnosis of hereditary spherocytosis. So fastly, let's discuss in summary. Hereditary spherocytosis, MCH, this is the only condition where HB concentration seems to increase but HB is decreased. Okay, this is MCHC increase, MCV decrease, RDW increase. So the things that increase are RDW and MCHC, the things that decrease are MCV and HB. So because HB is decreased, that's why pallor is there, fatigability is there, anemia is there. Okay, normally there is a cytoskeleton, cytoskeleton is there, which are SAB, means spectrin, enquiring and band 3.1. Since these are defective, the cytoskeleton is defective, so that's why spleen will start removing the membrane out of the RBCs. This will form a spherocyte. Because there is a difference in the size of these spherocytes, there is RDW increase. Since these are consumed by the spleen will work extra time. So because the spleen will work extra time, splenomegaly will occur. That's why we have to do splenectomy. In the splenectomy, if it is done in the splenectomy patients, we observe the howell bodies. Since macrophages are coming from the liver will unconjugated bilirubin will increase. That's why icterus is seen. Gradually the liver start recovering, and these conjugated bilirubin it sends to the gallbladder. The gallbladder forms gallbladder stone. That's why we have to do cholecystectomy in this patient. Coming to the diagnosis, osmotic fragility test. Normally resistance, osmotic fragility test resistant is normal RBCs, but hereditary spherocytosis, these RBCs will burst out of osmotic fragility test.